Welcome to my Kegels in Motion series, where we're going to be upgrading your pelvic floor strengthening to include movement, because real life is in motion and your pelvic floor strengthening needs to be too. When I'm helping my patients to strengthen their pelvic floors, we follow an important three-step process. Step 1. We have to begin with training our brain and our pelvic floor to be able to coordinate together with our breath and our lower abdominals in stationary positions. Step 2, we take this foundational training and then we apply it to movements that we do in regular life. And in step 3, we then take those movements and we add weight that is equivalent to a heavy bag of groceries, a toddler, and a car seat. So come join me in this 3-part Kegels in Motion series where we will be moving through each of these phases together. In order to get the most out of your Kegel training, we have to train your brain first. In today's session, you're going to need a mat and a chair because we're going to be exploring 3 different positions for 1 minute each. Let's get started. Let's begin on our hands and knees. Take a breath in through your nose for a count of 3. Exhale through your mouth like you're blowing out candles for a count of 3. Continue with that breath cycle as I bring more awareness to things in your body I want you to notice. On your inhale, notice how your belly expands, softening your lower abdominals to expand towards the floor. Also notice how that invites lengthening and space to happen between your sits bones. That's your pelvic floor lengthening in response to your inhale. As you exhale, blow your candles out and notice your lower abdominals reflexively contract and draw up towards your spine. Notice how that also reflexively invites your pelvic floor to contract, drawing the space between your 2 sits bones together. Continue to breathe, noticing these pieces and drawing awareness to connect even further. As you inhale, really breathe that space intentionally between the sits bones to create even more length if possible. Exhale, draw those sits bones towards each other consciously as you draw your low belly up away from the mat. Feel that co-contraction as you're breathing your air outward. Continue in this way for another 1 or 2 breaths, really focusing on that expansion on the inhale and the relaxation through your pelvic floor, and the exhale, drawing your pelvic floor up and in as your low abdominals join you in the process. Let's take these tools now up into sitting. So grab your chair, and you're going to be sitting with your feet grounded flat onto the floor. And I like to take my hands across my low belly so you can also feel that expansion happen. So again, taking a deep breath in for a count of 3 and feeling that expansion occur across your 2 hip bones and your pelvic floor melting down into the chair. As you exhale, feel that contraction across your low belly come together as you feel the space between your sits bones narrow and lift. Keep breathing in that way, noticing these different changes with your breath and your pelvic floor. So inhaling, expansion, exhale, and feel that pelvic floor lift. Notice as you're doing this if you're clenching your jaw or if you're lifting your shoulders or trying to use other muscles in your body to do this. If you do, that's okay. Notice those things and soften them and keep that focus on your breath and connecting in the different phases with your pelvic floor. So again, inhaling, letting that breath go down into your pelvis. Exhale to create that lift and that contraction. Now take this up into standing. I want you to notice and make sure that your knees are soft, so we're not locking them out. And keep your feet kind of shoulder distance apart. Take your hands across your belly again to notice all the same things. So as you inhale through your nose, think about that expansion through your low belly and expansion between your 2 sits bones, letting your pelvic floor lengthen. As you exhale, think about that contraction across your low belly and the lift of your pelvic floor between your 2 sits bones. As you do that, note if you're trying to use any other muscles in your body to perform this movement. A really common challenge is making sure your glutes are not clenching in the process of trying to contract your pelvic floor. They should stay soft. If you're not sure, take a hand and place it on one of your glutes while you leave the other hand over your low belly. Inhaling to feel that expansion and softening. Exhale to contract the two sits bones towards each other as you let your low abdominals gently contract also. Continuing to practice in each of these three positions to challenge your breath, and this coordination will allow your pelvic floor and your breath to start to get that practice down so it's not so much a manual process and eventually becomes automatic. If you found the movements that we explored in today's video to be challenging in terms of the coordination of all of these pieces, that is totally okay and understandable. This means that you are at the right level in terms of practicing your Kegel training with your breath and your lower abdominals. Getting more practice here so that you can be more successful when we add movement is the best place to start. I recommend going over this video at least once a day for the next week or so to allow the practice and the download of this sequence to become more automatic for you. Then you'll be able to take it into the next video in this series with more success.